there are two more questions for you in the comments. One is in uterus preservation surgeries, if you have the option of doing a hysteropexy, either it can be a uterosacral hysteropexy or ileococcygis, which is not actually done, or if you have the option of doing a Shirodkar or a Purandare, what would your preference be?
But I personally do lot more Purandare psychopexy because this is a reasonably good operation and we have got good results, including many patients have fallen pregnant. And but I mean, all procedures are equally good in the hand. So it depends on what what we are more experienced in it, and we have done that. But regarding like even we have done sacrospinous hysteropexy has also been done, but in that case also you have to use non-absorbable stitch. So sometimes that stitch can create little bit of problem. The patient may feel pain in that area and all, but can be done that also. So this Purandare psychopexy we tend to do more often.
So one more question that was there. What would be the reason that would preclude the use of pessaries? Which are those patients in which a pessary is going to definitely fail?
Okay, pessaries we did not discuss actually a lot about conservative management, but definitely pessaries have a role, and ring pessary. There are a lot of types of pessaries. That itself may be a separate class actually, but the somehow like they're fairly popular in UK and other countries. But the only problem of pessary is that they will work in only mild to moderate cases, not in severe cases. And in our Indian patients, because pessary has to be removed every day, cleaned with soap and water solution, dried, and the next day they to be put by the patient. So many patients will not do that. So what they tend to keep the pessary actually, and sometimes they forget about it. So many times then the pessary tends to get buried in the mucosa. I have seen 3 or 4 patients where we couldn't remove the pessary like that. The mucosa had grown on that. So in that case also what you can do that, but it was moving, I mean the pessary like. So what we do, instead of cutting the vaginal mucosa, we just cut the pessary with the scissors, and then we just rotated the pessary, and one end it came out, so we could remove it. And but there have been a case of vaginal carcinoma reported after forgotten pessary. So it may be a bit of nuisance. So somehow pessaries have not been very popular in India, and also the Indian weather, like humid weather and hot weather, is not very much suitable like for pessaries, and somehow many patients do not like it. It was fairly popular in UK. I worked in UK, so there is, I mean, every OPD we used to have a couple of patients coming to change the pessary every 6 months. So that can be, I mean, in exam you have to write and mention also that for mild to moderate prolapse, and the only definite role of pessary which we are still using in India also are two conditions, prolapse during pregnancy. That is one important indication where you can use the pessary temporarily. Similarly, early purpurium also, so that is temporary, and later on patient may not require it, or we can do surgery later on after like 3 months after delivery if still required. So that is the only that commonly used indication in India.